Today we'll be learning about the ankle control exercises in a hemiplegic patient. Here we have a model and let's assume that the right side is affected. The patient position will be in high sitting and we will try to dorsiflex the ankle. While doing so, we'll be stabilizing the pelvis. We hold on to the ankle and ask the patient to dorsiflex the ankle. Bend the ankle, bend the ankle, bend the ankle, and we stop. Moving on to the next exercise, we focus on the dorsiflexors and we ask the patient to extend their affected leg. We practice isolated knee extension along with dorsiflexion. One hand is on the knee and the other supports the ankle and we dorsiflex. We ask the patient to bend the ankle. Once we train the dorsiflexors in sitting position, we train the patient in standing position, where we ask the patient to take the unaffected leg forward, backward and to the side and weight bear on the affected side. We stabilize the hip and knee of the affected side and we ask the patient to clasp their hand forward and maintain balance forward, backward, to the side. Once the patient has achieved the forward, backward and sideways by weight bearing on the affected side, we progress to making a figure of 8 using the unaffected side. We stabilize the pelvis of the patient and ask the patient to use their unaffected side to make a figure of 8. Now from the figure of 8 position, we will progress to the pounding position using the unaffected side. We support the patient's affected side and ask them to weight bear on that side. We hold the pelvis and we ask the patient to pound. Now from pounding, we progress to stepping with the unaffected side. We ask the patient to weight bear on the affected side and place the unaffected foot on the stepper. We ask the patient to clasp their hands in front and maintain balance. While doing so, we stabilize the hip and knee of the affected side and we ask the patient to step. Once we have achieved stepping forwards, we will progress to step sideways with the unaffected side. We hold the affected side and we stabilize the leg of the affected side. And we ask the patient to step the unaffected leg to the side and we ask them to step on the stepper. Now we progress to stepping on a stepper with the affected leg. We ask the patient to keep the unaffected leg on the stepper and we stabilize the pelvis. Now we stabilize the hip and the knee of the affected leg and ask the patient to step the affected side on the stepper. Once the patient does that, we stabilize the anterior side of the knee and assist the patient to keep the affected leg back down. We progress next to asking the patient to step down the stepper using the unaffected leg. While doing so, we stabilize the pelvis and we ask the patient to tap the unaffected leg down. And we ask the patient to clasp their hands forward and maintain balance. We stabilize the knee and the hip of the patient and ask the patient to weight bear on the affected side and step down using the unaffected side. Now we progress to take the patient into side walking. We ask the patient to walk sideways along a line, crossing one foot in front of the other. When the sound leg takes a step, the affected hip must be kept well forward so that the knee does not snap back into extension. We support the patient's affected arm and ask the patient to start side walking. Now we will be demonstrating bandaging of the affected side in a hemiplegic patient. This is done to prevent contractures and to maintain the ankle in neutral position. We start from the medial side and we perform figure of 8 bandaging over the joints, and over the leg we just roll the crepe bandage, maintaining equal pressure over the limb.